Hmm? I think we're good. So on to dietary supplements. So we talked about the macronutrients, now we're going to look at the micronutrients. And I know there's a few people in the audience that think that maybe this business about multivitamins and micronutrients is probably more hype than it is reality. And I can tell you the more I study it, the more I recognize it's very, very important and real. And it's specific because some people are going to be low in some things and some people are going to be low in others. And it's our good clinical sense and testing that can tell us who is low in what and how to treat them so they can have optimal health. Americans are absolutely nutrient deficient. I mean, this is recent USDA from selenium to vitamin E. 68% of the population is deficient in magnesium, 48% in vitamin C. It's worse in our poor, and interestingly, it's worse in our obese. When you eat this sort of food, and the typical college student and young person, might get 40% of their calories from regular soft drinks and pizza and all of these different things. Potato chips and French fries and cake donuts. So it's no wonder why we would be nutrient deficient. These aren't nutrient dense, colorful food. We as doctors also make our patients nutrient deficient. Things like atenolol decreases CoQ10. Things like metformin drives down B12. And when you have low B12, you know what the deal is in regards to peripheral neuropathies and Alzheimer's and thought disorders. Simvastatin drives down CoQ, vitamin E. Hydrochlorothiazide really drains us of our important minerals. These are the 30 essential vitamins and minerals, from biotin to choline and all of those in between. And this is the map of human metabolism. We all recognize it. For me, it still makes me a little crazy and nervous, but because even studying it now, there's so much there to know. But here's what we know about it. In human beings, we have about 23,000 genes. Those 23,000 genes code for about 23,000 proteins and enzymes. That these 30 essential vitamins and minerals are cofactors for those enzymes. That magnesium is the cofactor for every DNA repair enzyme in our body. And that zinc is a cofactor for more than 2,000 enzymatic processes. If you don't get these, says Dr. Bruce Ames, and Dr. Bruce Ames is Professor Emeritus of Nutrition at Berkeley. He says if you don't get these, you simply age faster. And he developed something called the triage theory of nutrition, which I'm going to talk more about. He said that in this triage theory that essential proteins are given preference when nutrients are low. If zinc is low and magnesium low, we're going to take care of the basics. And the basics really are survival. So vitamin K, it's first going to go to clotting. It's not going to go to helping our bones or decreasing cancer like it also applies. Reproduction is really important. So things that are involved in reproduction are going to get, because we weren't designed evolutionarily to live 100 years, we were designed to live long enough to reproduce. So longevity is sacrificed if these nutrients are low. Long-term health for short-term survival. Bruce Ames. Bruce Ames is really amazing. He's in his late 80s, and he has some terrific YouTube lectures on nutrition that I've learned a lot from. So if there's low micronutrient, this is the Proceedings of the National Academy of Science, and this is something that Bruce Ames wrote, and it was low micronutrient intake may accelerate the degenerative diseases of aging. Allocation of scarce micronutrients by triage. Again, going to survival like clotting and reproduction. Let's talk about the vitamin trials, because there's some that really got my attention in regards to the dangers of vitamins. The CARROT trial, this is where this was in the 1990s, they used vitamin E and vitamin A, and the smokers who had a high antioxidative burden, they did worse with lung cancer, okay? So that was bad. The ATBC trial, 18% increase in lung cancer with beta carotene and a specific vitamin E. The SELECT trial, again, they used a specific vitamin E and there was an increased risk of prostate cancer. And then there's the Iowa's Woman Health Trial. And in that trial, there was increased mortality in women that took multivitamins. And interestingly, it was the women that took the multivitamin with iron. So, Annals of Internal Medicine said, enough is enough. Stop wasting money on vitamins and minerals. Well, let me give you a few other studies. This is a multivitamin study in the prevention of cancer in men, JAMA, 2012. In this large prevention trial of male physicians, daily multivitamin supplementation modestly, but significantly, decreased cancer. Vitamin supplement in breast cancer. In women that took a vitamin supplement, they had an 18% decrease in mortality and a 22% decrease risk of recurrence. So I know the physicians around probably want to take a multivitamin to reduce cancer, and I know women that have breast cancer might, based on these good studies. What about this study that was just published in the journal Stroke in May? It was May 2015. 71,000 patients in Japan, 20 years follow-up. Multivitamin use, particularly frequent use, was associated with a reduced risk of total and ischemic stroke mortality. Big study. And then what about this ARED study? All of us have heard about the age-related eye disease study, right? And they use things like low-dose beta-carotene. Low-dose beta-carotene, that's important. Vitamin C, copper, vitamin E. It reduced the worsening of macular degeneration by 25%. That's a biggie. It's a biggie because macular degeneration is the #1 cause of blindness in our elderly. And I want you to just think about this. The retina of the eye is one of the most metabolically active places in our body, right? It has to do so much to absorb those photons, regenerate, see light, tell the brain what to do, and it needs those antioxidants to protect it. And that area where it does the most work in the macula, and the fovea of that macula, is really nutrient dependent and antioxidant dependent. So clearly, if these sort of antioxidants can change macular degeneration, they can have effect, if we use them right, on other very oxidatively challenged areas of our body. Few are as challenged as the macula, but it works there, and that's the mechanism, and that's why there's for me, so much excitement in this area about using them right, knowing how to use them. So the summary is this. All negative reports of multivitamins used vitamin E in the simple form, DL, simple and cheap, simple form, DL tocopherol. I'll tell you why that's important in a minute. They used beta-carotene and they used iron. Those three guys. We need to be careful about that. Vitamin E is a family of 8 different brothers and sisters, tocopherols, tocotrienols, and gamma-tocotrienol is anti-cancer. So if you give a bunch of tocopherol, you block the absorption of the natural tocotrienol. Of course, you're going to have more problems with that. You need to avoid beta-carotene. You can use other carotenoids like lutein, which is great for the eyes. And you got to leave out the iron in women that are not menstruating, in all men, period. You don't need that additional oxidative stress. This is a multivitamin that you might see at the store. It has vitamin A in the form of beta-carotene. You don't want this multivitamin. It has low-dose vitamin D of 400. And it has folic acid in the standard form. The reason they use folic acid, it was made in the 1940s because it has a shelf life of about 10 years. It's a new to human molecule. We don't really want folic acid in our body. 1 tablet a day. Multivitamin. 2 is a serving. Vitamin A is mixed carotenoids. Vitamin D is 600, still a little bit low, I think. Vitamin E is mixed tocopherols and tocotrienols. Now we're talking more natural product here. It has folate in the methylfolate. That's how when you eat spinach and chard and kale, you're getting all sorts of different folates. You're not getting folic acid. You're getting methylfolate. And it has no iron. When you're looking at vitamins and supplements, you want to look for a couple of labels. You want to look for the USP. It means it's verified. What is on the label is in the bottle. It also needs to have the good manufacturing, the GMP on there. What is on the label is in the bottle. Now, dietary supplements, you hear all the time that they're not regulated. That's not true. There's the DSHEA, Dietary Supplement Law Act in 1994 that gives GMP and USP ability to regulate. Now what they don't do is they verify ingredients, they don't verify effectiveness. You know, if metformin, a new drug, there has to do both. So there's a different bar to go over for the supplements. But it's not that they're unregulated. Vitamin D. Things that occur with vitamin D deficiency: increased cardiovascular disease, increased autoimmune diseases, brain health issues, cancer, infections. We'll talk about a few studies that really cement this. The role of vitamin D in reducing cancer risk and progression. Clinical studies, this was 2014 Nature reviews. Clinical studies strongly suggest that vitamin D deficiency increases the risk of developing cancer. Vitamin D in dementia, neurology, 2014, 1,700 patients. If the vitamin D level was less than 20, a 69% increased risk of dementia. If the vitamin D level was less than 10, 122% risk. What about vitamin D and heart failure? I was amazed by this. This is a 2016 paper, April. Vitamin D3, this was a head-to-head study where they supplemented one group, they didn't supplement the other group. There was a 30% increase in the injection fraction of that heart in 1 year with vitamin D. And at the bottom there was also that you can use CoQ10 to help congestive heart failure. This is vitamin D and mortality. As vitamin D levels go up, all-cause mortality goes down. Good levels are about 50 for most people. Yes?
How high is too high?
Yeah. How much vitamin D is too high? This is where you really kind of need to know the person. So if a person has autoimmune disease or cancer, I'm going to push that level 50, 60, 70 and feel real comfortable with it. We know the upper limits of normal are 100. I'll tell you, my mailman that has a walking route with no vitamin D supplementation has a vitamin D level of 81. Okay? But I'm going to push it, 50, 60, 70. Now, if they've got kidney stones, I'm not going to push it so far. This is another one on all-cause mortality. As you increase the level of vitamin D, all-cause mortality goes down. Vitamin D and asthma. This is a Cochrane review just a few weeks ago. 7 studies, placebo-controlled. There was a 50% decreased risk of asthma exacerbation and ER visit with increasing vitamin D. 50% decrease. And it also decreased the risk or the need for steroids in these people. The American Journal of Public Health, 2014. Vitamin D testing for everyone. Vitamin D testing for everyone. Our Journal of Public Health. I'm not yet doing that, but I'm almost doing that. And I bet you are getting more, doing that more and more often too.
What's the low Medicare?
Yeah, Medicare. The bottom line for vitamin D, test levels if you can. Treat to optimal levels of 40 to 60, I said 40 to 80. Vitamin D3 is the best replacement. Vitamin D2 that we have in the 50,000 actually is not optimal. I won't go into details fully on that, but you're much better having them take 5,000 a day of vitamin D3 than 50,000 of D2. D2 gets in the way. If not testing, most people it's about 2,000 a day. The Institute of Medicine is a very conservative body of medicine, and they recommended the 600, 800, 1,000. You might eke somebody into the 20s if they're low in that, but you're not going to keep them in the 40 range at 800 or 1,000 very often. So a couple of slides here on calcium. BMJ 2015, conclusion. Calcium is unlikely to lead to clinically significant reduction in risk of fracture. Okay, so this is a big difference from what we've been told. They just told us that in this study, calcium supplementation makes little difference in osteoporosis. Second study, BMJ, calcium intake and the risk of fracture. There is no clinical trial evidence that increasing calcium intake from dietary sources prevents fracture. None. I use calcium in my diet. In my patients for sure. This is interesting, and I'll give you more from Walter Willett here. So Walter Willett, again, our premier educator and researcher in nutrition in this country. Surprisingly, only a minor effect of bone mineral density. He said, with adding calcium to somebody that's not taking calcium, you will get a 1% increase in bone mineral density, and it's not cumulative. It's 1% only. 1% only. So it doesn't go up 1% this year and 1% next year and 1%. So I'll take that 1%, but it's not as impressive as we thought. And he said, much better off taking the cow for a walk than drinking a glass of milk or taking calcium. So what do I think about calcium intake? The Institute of Medicine tells us that we need 1,200 milligrams a day. This is how they came to that. They know from actual nutrition studies that human beings need to absorb 800 milligrams a day because they lose 800 in their urine. They said, let's put a little fudge factor on it, increase it by 50%, we'll make sure everybody gets what they need. Okay? That's how they came up with 1,200. A healthy diet without milk products is going to have at least 600 milligrams of calcium. What I like to do is use 200 or 300 milligrams twice a day. 2 or 3, and you can use calcium carbonate, but I like calcium citrate because I know with calcium citrate I'm going to decrease the risk of kidney stones rather than increase the risk of kidney stones. This is an interesting study about vegetables and nuts improving bone density. Bone mineral density, more with fruits and nuts. Okay, so in the first bullet there it said that women that eat these have better bone mineral density if they eat these in childhood. But if they had dairy, there wasn't an increase in bone health. Fruits and veggies decrease hip fractures. Interestingly, that fruits and berries can increase osteoblast activity, and they can suppress osteoclast activity. Now, remember what I said about a 1% increase in bone mineral density with calcium? There's a 5% with increased fruits and vegetables. 5%. I'll take that too. If you don't know this website, nutritionfacts.org, it is fabulous. He sends out a 4 to 5 minute video on nutrition facts 2 or 3 days a week. I love it. He's great, Dr. Gregor, nutritionfacts.org. So what about dried plums for bone mineral density? This is a unique study. So they found that people that ate plums 5 to 10 a day prevented bone loss. It was both preventive on the osteoclast side and it was anabolic on the osteoblast side. All of my patients that have bone mineral density issues, I ask them to take plums, dried plums, 5 or 10 a day, not for their bowels, but for their bones. The effect of dried plums on bones, this is another study that says the same thing. 5 to 10 a day made a significant difference. Dried plums significantly increased bone mineral density in the ulna and the spine.
That's otherwise known as prunes?
Yeah. The California Plum Board calls it dried plums now because of the connotations with prunes. This is a slide to tell you can get calcium from a lot of different places. Lentils have a lot. Broccoli has 100 milligrams per serving. Salmon has it. There's some in orange juice. There's some in the green vegetables. You don't need dairy. You can have dairy, sure. You can certainly have dairy if that's right for you in your diet. Vitamin K2, is anybody using that? There's a couple out there. So vitamin K2 is one of the most important vitamins you don't know about if you're not using it, or you may not know about. Vitamin K2 builds strong bones. Vitamin K is found in green leaves. Vitamin K2 is actually found in things like grass-fed butter, for example. It's metabolized from standard vitamin K in our gut and in the guts of animals. And 50 to 200 micrograms a day do some amazing things for bones and blood vessels. K2, menaquinone supplementation, and the benefits for cardiovascular disease and osteoporosis. Vitamin K2, so this protein called osteocalcin that we need to actually make bone stronger is a vitamin K dependent enzyme. And And if, that triage theory where vitamin K would go to other things, well, maybe if you don't have all of the nutrition and you won't get enough osteocalcin. Vitamin K increases osteocalcin and increases bone. It also increases something called matrix GLA protein. And why that's important is matrix GLA protein actually extracts calcium from the arteries, suppresses calcium deposition in the arteries. So this K2 is good for our patients for both of those reasons, 50 to 200 micrograms. 55% of the population is low in magnesium. It's involved in hundreds of physiological processes, those enzymes we talked about. And it's often low. In our patients that are taking diuretics or PPIs, it's going to be low. And it does so many things in regards to improving the immune system. The dosage is between 200 and 1,000 milligrams a day. And the thing to know about magnesium, as long as they have a creatinine that's less than about 4, you can give them as much magnesium as you want, and they're going to pass it through their gut. And what you get is you get diarrhea, and for some of our patients, moving their bowels a little more briskly is a good thing. So I use magnesium often with constipation. And I like magnesium citrate because it's in the capsule form on a daily basis to provide some magnesium supplementation and also to help people that tend to have more constipation. Omega-3s. So this is, I just want to stop here just a little bit. If you can think about over the last 5 or 10 years what you've heard about omega-3s. Some days you hear in the news that omega-3s are great. Some days you hear, well, they didn't do this, they didn't stop atrial fibrillation, they didn't work here and they did work here. So it's easy for us as physicians to be confused about their benefit, and clearly for our patients. We know they lower triglycerides. We all use them for that. They do improve cardiovascular health, and I'll give you some strong data behind that. They decrease inflammation, some data about that. And they improve cognitive development in children. We talked about that in eating fish, how it improved cognitive development in children. And it's beneficial for memory and analysis. This is JAMA Internal Medicine, August 2016. So I don't think you have this slide. So this is where they actually looked at the biomarkers. 45,000 patients, pooled data of 19 studies, so lots of patients, lots of studies. Dr. Walter Willett, again, and Dr. Mazafarian. Omega-3 tissue samples tested, so they tested the actual level in the blood and in the tissue. And when they were in the elevated range, there was a 10% decrease in fatal MIs. So this is a big meta-analysis where they actually, many of the studies where they showed that there wasn't any benefit of omega-3s, they didn't test the levels. They said, here, take this or take that, but they didn't test the levels. This is in circulation. This is I think, August also of 2016. So they gave people, after they had an MI, they gave them some omega-3s to get their levels up in their tissue, and they found that there was decreased scarring and there was increased ejection fraction, reduced adverse left ventricular remodeling, and increased, you can see that here. There was, I don't have the labels on that. I think the one to the far right, the 2.1 to the 4.8, had to do with the increase in ejection fraction. Sorry, I don't have that. Oh, there's the infarct side is there, and then ejection fraction. Yeah, there it is. So the bottom line on omega-3s, the bulk of the data is strongly suggestive that omega-3s promote health. So some advanced nutritional testing. I talked about how we can target it for our patients. This is a test that's called a NutrEval. It's done by a lab called Genova, and it gives me information about 30 different minerals and multivitamins and amino acids. And this patient here had low B vitamin. And I could also look at their amino acids, and they were low in glycine and they were low in histidine. Some people don't absorb these things, and this might be a patient that would really benefit from collagen, but we can get an idea how effective they absorb amino acids or how much protein they're eating. But a lot of these people that have low amino acids will be eating enough protein, you would think, but they're not necessarily absorbing. This same test tells us about fatty acids. So up on the left, we actually can measure blood levels of EPA and DHA. What they do actually is they grind the red blood cell membrane to get the fatty acid percentages. We can look at the omega-9s, that's the olive oil. This person was very high in that. We can look at things like trans fats, that's over on the right in the middle, which is obviously a deleterious fat. And if people tell you that they're not eating much junk and their trans fats are high, like this person's are moving towards high level, they probably aren't reading labels as well as they should. In the same test, we can look for minerals from copper to zinc and selenium. We can look for toxic minerals. This is again from the red blood cell. And we can look at markers of oxidative stress. This is a test I use often, and it's very helpful for me to target the right nutritional therapies for people. I want to mention a little bit about CoQ10, how it's a factor in energy metabolism. It's part of the electron transport chain in the mitochondria. It's used for hypertension. It actually lowers blood pressure. It's used in Parkinson's, and it's used in congestive heart failure. The dose is between 50 and 400 milligrams a day, and it's very, very safe. Published. This is in the Journal of the American College of Cardiology. What they found is if you gave a good quality omega-3, 100 milligrams 3 times a day, that you could decrease the cardiovascular risk, the relative risk of death in a patient with congestive heart failure by 44%. This is a very safe, it's not inexpensive. You'd spend $50 to $60 a month to take 100 milligrams 3 times a day. But I think it would, for those people with congestive heart failure, I think they'd want to do this. You'd want to have their vitamin D level right, getting them exercise, and then all of the other wonderful medicines that support them, the spironolactone and the metoprolol and the ACE inhibitors. And that's a great integrative approach to enhancing their life and their capabilities. This is one on skin cancer prevention that I think can help many of your patients, particularly the ones that like to play golf. So this is a study out of Australia, and it uses nicotinamide, not niacin, but special form nicotinamide. So this is a non-flush. And they showed that if they took 500 milligrams twice a day, they could reduce the risk of recurrence of basal cell or squamous cell skin cancer by 23%, done in Australia. Safe, inexpensive, and very effective. We're going to talk a lot more about the gut this afternoon or this late morning, but probiotics are clearly beneficial bacteria and yeast. We use them for lots of different things, from irritable bowel syndrome, where the number needed to treat is just 4. Just 1 in 4 people will get better, which is a really low number needed to treat. Constipation, interestingly, diarrhea, they can help as well. Preventing antibiotic-associated diarrhea, allergies and asthma, and preventing respiratory. There was a nice study where they actually gave kids and children in daycare, they gave them a probiotic, and they followed them through the winter months. And the children that got the probiotic, lactobacillus probiotic and a bifidobacter, that they had less GI infections and they were able to attend daycare more often. But in addition to less GI infections, they had less respiratory tract viruses as well. And so by the parents giving the child the probiotic throughout the winter months, they were able to attend work more in the child's day. The biggies when you choose a probiotic, you really want to look for a combination typically of lactobacillus, of bifidobacteria, and often Saccharomyces, that's a yeast. And those 3 are often found together, and they can be very helpful. And the dose is usually in the 10 to 30 billion range. And probiotics are best taken with meals. Sometimes you'll see on the package that it says take on an empty stomach. The reason you take it with a meal is because on an empty stomach, the pH of your stomach is about 1. And a lot of those probiotics are going to die in that pH of 1. But as soon as you put the food in there, it goes to 3 or 4. It's much likely to make it through your stomach into your small intestine. Are any of you using curcumin at all in your practice? Yeah, I see a hand there. In your own life? Yeah. Curcumin's amazing. There's thousands and thousands of PubMed studies in the last few years on its anti-inflammatory effect, its effect in regards to potentiating liver function, and its anti-cancer effect studies from MD. There's a study from UCLA on brain health and how it can decrease some of the deposition of beta amyloid. We are seeing that curcumin treatment delays the buildup of plaques and tangles. This is a study with depression where they were given 500 milligrams of curcumin, which is an extract from the rhizome turmeric. And if they were given it twice a day, they did better in regards to depression. Some of the SSRI resistant depressions will do better if you add the curcumin 500 milligrams twice a day. No risk to this. And it's really not very expensive at all. And we're getting to the end of this one. These are some natural relaxing teas. Lavender and passion flower and chamomile. Anybody out there use these? I see a couple yawns. Maybe you were using it earlier. So there's some hands, right? So what it does is it increases GABA in the brain, and GABA is a naturally relaxing neurotransmitter. And theanine is a green tea. It's an amino acid that's a non-structural amino acid that is an extract from green tea, and it's amazingly relaxing. And it gives you a quiet focus without sedation. Terrific for anxiety, very low. I've used it for probably about 5 to 8 years now, and I don't think I've ever seen a side effect on it. People do very well with it. 200 milligrams. So basic supplement recommendations, just to kind of tie this together here. A multivitamin, I think, for most people, without beta carotene, without iron, with the right vitamin E. Vitamin D for most people. And omega-3, I think, for most people, based on this data. Calcium, 200 milligrams twice a day. Vitamin B12, if you're older than 50, many of us are going to have problems absorbing vitamin B12. CoQ10, if you're on a statin or if you have congestive heart failure. Vitamin K2, if you're concerned about their bones or their heart. Magnesium for cardiovascular disease, for diabetes. It increases insulin sensitivity and for restless leg syndrome. Probiotic with anybody that has GI concerns or autoimmune concerns. And then you can do some personalized testing to find what people really need if they're not functioning at their highest level. And I just underlined the 3 that I would think would be good for most people, and the other ones you can use as needed and in a targeted way. So I don't think people need to necessarily take a bunch of pills every day, but 3 may be very reasonable. And that's it. Yes, question in the back. I have to ask, I can't hear you well enough to, I know you asked about a multivitamin. Can somebody help me with that?